Thank you for this kind words, sir. At the outset, I would like to thank Dr. Prashant, sir, to give me this opportunity to come here and be among all the PD warriors to present on recent advances in Parkinson disease. So hello, everyone. Thank you for being here today. Whether you have Parkinson's or care for someone who does, or are here to learn, your presence means a lot. Dealing with Parkinson's isn't easy. Today we explore the new treatments. Before we start, take a moment, recognize your strength, and let's learn about what are the new advances of Parkinson's, especially the therapeutics. Just a brief overview, what is Parkinson disease? We all know, I'll make it very simple. Parkinson disease is a neurodegenerative condition. There's a region called the substantia nigra which has been affected. So there is a progressive breakdown or deterioration of dopamine producing cells in that area. So the main chemical called as dopamine becomes deficient, and which leads to all the consequences or the presence of these symptoms called as movements, cognition, sleep, and quality of life may be impaired. Why does it happen? Already been extensively spoken in the scientific sessions. 5 to 10% reason is genetics, Parkin being the commonest mutation. Then we have the environmental factors which comprise about 70 to 80%. Exposure to pesticides, herbicides, solvents, air pollution, water pollution, head trauma, and certain chronic medications. And obviously a few gone bad substances in the brain, Lewy bodies or alpha-synuclein. Now who gets affected? As we know, once we have these symptoms of Parkinson's, the movement becomes slow. There are non-motor symptoms like cognition, sleep, etc. being affected, which affects the activities of daily living like dressing, eating, or other routine activities, which again indirectly affects the participation in the career or the family activities or the social activities. And then you have these indirect affection to the environmental factors like family support, friend support, and social support. So overall, people with this condition and people caring for people with the condition get affected biopsychosocially. Now, how to beat the PD illness with? I believe these 4 E's are very important to beat the PD illness. Early diagnosis, early treatment, earnest compliance, and excel with the knowledge on recent advances. So these are the 4 E's which everyone should be aware to beat the PD illness. This is another slide which I want to tell. If you know these 10 terms as a PD warriors, you will know that you are neuro-informed and you become a hero or a heroine. One is substantia nigra, which is the area which is involved in the brain. Dopamine is the chemical hormone which gets deficient. It's a neurodegenerative condition. Parkin is the commonest mutation involved. Pathologically, there are Lewy bodies and alpha-synuclein. Importance of early diagnosis of Parkinson's, importance of early treatment, importance of earnest compliance, and recent advancement in Parkinson disease. So I'm going to speak about recent advances. Before going there, these are the treatment available currently. We have medications which are dopamine replacement agents, which as sir just told that many patients are on levodopa, carbidopa, that is syndopa. Then we have the COMT inhibitors. We have apomorphine. We have dopamine agonists like ergot and non-ergot medications. Then we have the selective MAO-B inhibitors like selegiline, rasagiline. And then we have the non-dopaminic agents like anticholinergics and the NMD antagonist amantadine. Surgeries which are there and been happening since last 15-20 years now, deep brain stimulation, lesioning surgeries like palidotomy and thalamotomy. Then we have obviously the rehab, physical therapy, occupational therapy, cognitive therapy, and speech language therapy. DBS, I'm sure a few of them must be knowing here. It's an implantation of electrodes into the specific areas of the brain, especially the subthalamic nucleus or the globus pallidus, interna, and this acts by delivering electrical impulses to modulate the neural circuits, helping to alleviate the motor symptoms and reduce the off time, and thus improve the quality of life. Yes, it is effective. By providing continuous stimulation to the targeted brain areas, it helps to minimize the fluctuations in symptoms. So selective patients are definitely, DBS may help. Now, what are the advancements in treatment we have since last 5-7 years? These are some new agents and new formulations for treating Parkinson's which have been approved from 2017 to 2022. Certain medications, they have changed the formulations. For example, we have the first drug that is the carbidopa levodopa, which is available in segmented, fragmented forms. So it's a scoreable tablet. You can break into 1/4, and that gives us a 6.25 and 25 mg per segment. So you can take a precise medicine if you want to. So this is available now. Then we have, for the off periods, we have few medications like levodopa inhalation powder form. So far it's not available in India. So it is a 42 mg of levodopa oral inhalation cartridge, and it contains 2 tablets of 84 mg of inhalation. Up to 5 times a day you can take this. Then you have the sublingual apomorphine. Again, this is not available in India. Its dose is 10 to 15 to 20, 25 to 30 mg sublingual film. This again helps for off periods and adjunctive therapy for levodopa. Then we have the new one, MAO-B inhibitor. It's a reversible MAO-B inhibitor, safinamide, which is available now and very much used, 50 to 100 mg oral tablets. Then we have adenosine receptor antagonist called as istradefilin. That's not available in India. It's used in mainly Japan and US. Again, this is adenosine receptor antagonist used as 20 to 40 mg oral tablets, mainly used as for off periods. Then you have the COMT inhibitor opicapone. It's an OD dose, mainly for increasing the on time. So it's an adjunct to levodopa, 50 mg tablets, not available still in India. Then you have for dyskinesias. For dyskinesias, you have this extended release NMD antagonist called as amantadine ER, and which are available in different strengths, 129, 193 and 258 mg. It's available in India, these 2 strengths, 129 and 193, and it's very much used for dyskinesias, levodopa-induced dyskinesias. Newer drugs, my colleague is going to speak on this for next talk. Now coming to those was about medications which we saw. Now we have the newer devices which have been used since last 5-7 years, called as adaptive DBS. Now as I told you, DBS is very much there since last 25-30 years, but there is they've come with a new technology called as adaptive DBS. So these are closed loop adaptive DBS which can deliver individualized therapy at an unprecedented temporal precision for PD. So this uses local field potentials, that is the beta activity, which are related to the PD motor symptoms. So this provides a real-time feedback. So what is required for patient's best response. Then you have the continuous apomorphine infusion. It's an innovative approach for continuous infusion apomorphine, mainly via a portable infusion pump. Then we have the continuous intestinal infusion of levodopa carbidopa gel. This is mainly for continuous infusions to prevent motor fluctuations, mainly used for advanced PD. Now what is apomorphine? Apomorphine is a drug used to treat off episodes in Parkinson disease, mainly sudden offs or early morning offs. This is effective for rapidly relieving motor fluctuations. So it's a very short acting, it's given a subcutaneous route, very short acting, acts in 5 to 10 minutes, and the action lasts for about 45 to 50 minutes. It stimulates mainly D1 and D2 receptors, and this is mainly used again in advanced treatment options for sudden offs or motor fluctuations and dyskinesias. If a patient requires more than 5 to 7 injections, subcutaneous injections per day, then we can make it as a continuous apomorphine infusion. We can insert a pump and we can use it as a continuous delivery system. And this is duodopa. This is directly delivered to the intestine. Again, it's an invasive procedure, involves a percutaneous gastrostomy with jejunal port placement and connected to a portable infusion pump. So this is again continuous delivery of levodopa, has a predictable absorption, mainly used in advanced PD. Now these are some non-invasive devices which have been used, not everywhere, but few centers do. Non-invasive vagal nerve stimulation, mainly used for pain. It modulates the neural pathways involved in pain perception neural activities. Then we have the peripheral nerve stimulation. It involves the placement of electrodes near the peripheral nerves to deliver electrical impulses, still under investigation but shows promise in addressing symptoms, in addressing motor symptoms. Then we have this repetitive transcranial magnetic stimulation. So this technique involves magnetic fields to stimulate the specific brain areas, and this may help in improving the motor symptoms. Then you have spinal cord stimulation. Spinal cord stimulation mainly used for gait freezing or gait difficulty. This involves delivering electrical impulses to the spinal cord. Again, it's a non-invasive, minimally invasive therapy to address PD symptoms. Again, stimulation will be spoken by my colleague in the next talk. Then you have the electrical peroneal nerve stimulation. Involves application of electrical impulses to the peroneal nerve. It helps in gait improvement and motor functions. Then you have some smart glasses, wearable devices, which again will be spoken by my colleague. We have this vibrotactile stimulation come up now, which involves the use of vibration to stimulate the sense of touch, offering to non-invasive approach to improve sensory feedback and motor functions in Parkinson's disease. Then you have gloves now available for tremors, which may help in reducing the compression. It acts by compression and stabilization, offering individuals with Parkinson's disease to alleviate hand tremors. So this is a schematic representation of various devices, invasive and non-invasive devices used to decrease the PD symptoms. Then we have another advancement with MRI-guided focused ultrasound. This is an innovative, minimally invasive surgical treatment for PD. This has mainly been FDA approved in 2018. Patients are placed with a stereotactic head frame, like this, with a mount stereotactic head frame, with an MRI-compatible ultrasound transducer. So here what we do is, we basically thermal ablate the target, which like it can be thalamus or it can be STN. So here mainly used for tremor-predominant Parkinson's disease. The advantage is it is an incision-less surgery, real-time monitoring can be done and no implantation required. So less of side effects. But disadvantage is the skull characteristics may vary depending on person to person. It can only be done unilaterally. It's non-adjustable and relevant adverse effects can be there, like speech difficulty or gait imbalance. Comparing with DBS, it is still in the early phase. It's a naive, limited studies are there. Few patients and long-term benefits uncertainties exist. Then we have the role of physical therapy and exercise in Parkinson's disease, which is very important to overall improve the outcome or the overall quality of life in the terms of aerobics training, resistance training, balance training, and gait training. And then we have some newer complementary strategies for managing Parkinson's disease. We have art therapy, dance therapy, music therapy, and mindfulness. This is the paper which I published recently for Parkinson's disease and dance therapy. This was the initial experience. We tried for 2 patients initially. Now obviously we extrapolated to 25 patients. So we had a Garba dance for Parkinson patients, and because of the movement, it was quite, the movement, the rhythmic movement, what it had, along with the high beat music. So that was very engaging. So patients did very good in terms of motor and non-motor response. So we are now, it's under review with the full original article of 25 patients. I hope it gets published. So this is another thing we can try. So to conclude, levodopa is still the gold standard for Parkinson's. The search for medications for PD has continued with treatment utilizing already existing drugs as well as development of new drugs like newer formulations and then newer devices. Treatment options for motor fluctuations as symptomatic therapy are being developing with novel agents and advances in device and formulation technology. Invasive devices are effective more than non-invasive devices in terms of improving motor functions. DBS has a striking effect, especially the adaptive DBS, as compared to conventional DBS, pointing to instrumental advances. Exercise as a global intervention for all symptoms of PD continues to be an active area of research, including other unconventional forms like music, dance, and art therapy. This is my recent patient with DBS last week. We did an adaptive DBS for her. Thank you.